Hello and welcome to this episode of Health and You. I am Sumi Sukanya Datta, and today's topic of discussion is an acute shortage of faculties in India's medical colleges, mainly the ones which have come up over the last few years. To contextualize, there has been an increase of over 90% in medical colleges from 387 before 2014 to 780 in 2025, which was presented in the economic survey report today. But the million dollar question is, where is the faculty to teach the students who get admitted to these colleges? To discuss this, we have two eminent guests, Dr. Ravi Vankherkar and Dr. Jai Krishnan Alapat. Dr. Vankherkar is professor of surgery at Government Medical College in Dhule and past president of the Indian Medical Association. And Dr. Alapat is a neurosurgeon and member of Kerala State Medical Council, also a member of Indian Medical Association. Welcome, Dr. Ravi Vankherkar and Dr. Alapat, for joining us in the discussion today. We'll start by asking you, Dr. Vankherkar, what do you think about the government being on a sort of spree to opening new medical colleges in order to address the shortage of doctors in the country?
Thank you. To answer your question is very straightforward. There is absolutely no shortage of doctors in India. If you see the health minister's reply in the winter session of parliament, the ratio of WHO recommended ratio of 1:1,000 now in India is around 836 to 1 doctor. And surprisingly, in the southern states, it comes around 500 patients and 1 doctor. So there is no truth in this statement that there is a shortage of doctors. This needs to be underlined again and again because all the policies are framed as if there is a huge shortage of doctors. My friend Dr. JK will tell you what is the situation in Kerala. We at Indian Medical Association had to form an employment bureau for doctors. There is massive unemployment for fresh graduates and fresh postgraduates. So that is point number one. The spree, you have rightly said, the government is on a spree of opening new medical colleges without a master plan nationwide. This is just to score political points, as you said, that they just want to announce that in last 10 years we have tripled the UG seats and doubled the postgraduate seats. India now produces more than 110,000 MBBS graduates. Add to it around 30,000-40,000 MBBS graduates coming from various foreign countries, especially the previous USSR, China, Philippines, etc. And we are now facing a huge problem of unemployment. Instead, government should make a master plan and decide where there is a necessity of a medical college.
Absolutely. Dr. Alapat, you come from Kerala, and as Dr. Vankherkar was pointing out, the situation is particularly stark in states like yours and also in other southern states. Would you like to speak a little about, what exactly is the ground situation?
Yes, as Dr. Ravi Vankherkar has rightly told, there is a skewed distribution of doctors in India, especially if you consider the southern states and some other states. There is surplus manpower, but in some states there is sufficient manpower is lacking. If you consider Kerala, in Kerala is a small state with a population of around 3 crores. And we have at present more than 1 lakh doctors in Kerala. And every year, another 7,000 doctors are being added. And the postgraduate seats are also in par with the undergraduate seats. Almost 3,000 postgraduate seats are also there, apart from some other D&B courses and all. So there is the ratio of doctors in Kerala may be less than 500. It may come to around 400 per thousand population in compared to other states. And in Tamil Nadu, Karnataka, and Andhra also the situation is same. And there is surplus manpower, I think, in Maharashtra, even in Gujarat, except in Uttar Pradesh, Bihar, Orissa, and some other states. There is surplus manpower of doctors in India.
Yeah.
Now the government is frantically going in for adding medical colleges and adding medical manpower is a method to address their aim of attaining the sustainable development goals. The sustainable development goals speaks of universal health access. So the problem of universal health access is not due to lack of medical manpower, but lack of skewed distribution. In some states, the medical manpower is not uniformly distributed. Some of the rural areas lack medical manpower due to lack of facilities.
Absolutely.
IMA had already suggested that there should be a national medical service, an Indian medical service, by which the government of India should recruit medical manpower as they are doing in Indian administrative service and distribute it to the states. Only if there is uniform working conditions, people will join, because the medical graduates from Kerala now cannot join the Bihar medical service.
Yeah.
There are a lot of hurdles are there. So these issues have to be addressed. Otherwise, adding medical college will be a big issue, because there will not be properly trained faculties. Mushrooming of medical college is not a solution. And now the government has come up with a proposal that the experienced doctors in government services can join as faculties without teaching experience. Whether that will also help to improve the quality of medical education is doubtful. That's the current situation in India.
Wonderful insights there. One standard argument that the government often gives is that this is a cyclical process. So once you start the college, and then the faculties will come later. What do you say about that, Dr. Vankirkar?
Uh, Before answering your question, just to add what Dr. JK has said,
Mhm.
that there is a skewed distribution, especially urban areas versus rural areas, but this is absolutely due to bad governance. Not only the facilities provided in the hospitals for a particular specialist are not available, they are woefully inadequate. Residential facilities are not there. The transfer policies in government sector is not regular, and not to speak of corruption. There are no full-time regular posts available. The government fills only on 11-month contract. And at many places, I am honest and blunt enough to say that unless and until you pay 1 month salary, you don't get a continuation of your contract for next 11 months. This is leading to shortage. Government should improve the governance, which includes everything in the rural areas. So many doctors are ready to join. And about the private sector, whichever areas are underserved, the government should declare them as D or D plus zones, which they do it for industries and give subsidies. Similar kind of incentives, either in form of subsidized land or a tax rebate for next 5 years for private hospitals to come up in rural areas. Now,
Yeah.
coming to your question, can you repeat it?
Yeah. So basically, I wanted to understand that government says that it's a cyclical
Yeah,
process.
yeah.
Yeah. So,
Is
once the medical college is started, after a few years, we'll have better infrastructure and faculty in place to train students and teach students.
his government argument is was holding true 50, 20 years back. But if you will see in last 25 years, whatever medical colleges have opened, there is still a woeful shortage not only of infrastructure but also of faculty and patients. In the
Mm-hmm.
private medical college sector, they build huge buildings and they are empty, their wards are empty. Faculty is mostly a ghost faculty. In government medical colleges, they have lots of patients, but buildings are not there and staff is not there. So this argument absolutely holds no water that it is a cyclical process and eventually they will develop. It was happening when previously BJ Medical College was established, JJ Medical College was established, or Madras Medical College was established, or your MAMC was established, where enough faculty was there, enough patients were there. Hence, I will again repeat, government should make a nationwide master plan that yes, these areas should requires a medical college. And another important point is they should keep 50% seats reserved with a compulsory bond that say a Chhattisgarh Bastar district. There are not enough doctors. So you want to open a medical college in Bastar, give admission to 50% students from Bastar district. And then they will automatically would like to stay in their own district once they pass out. So there should
Yeah.
be such a policy to really address this cube
Yeah.
distribution.
So I think year before now, NMC had come up with this proposal, which was eventually withdrawn. That southern states will not there had to be some sort of limit for, population based on the MBBS seats. There would be 100 seats per 10 lakh population is what the proposal was. But at the behest of the government, this proposal was sort of withdrawn, and there was particularly pushback from southern states, Tamil Nadu and Kerala mainly. What do you I would like to hear from both of you on what do you think about, do you think this is such a very radical move, like you also, Dr. Vankekar, have just proposed that there should be this kind of reservation in medical colleges which come up now. So this condition that medical colleges and medical seats should be based on the population in a state, how do you think about that? What do you think about that? Dr. Alapat, would you like to start on this?
Definitely.
Definitely. Actually, the professionals, the number of professionals should be based on the population itself. Otherwise, because the society has to support these professionals, then only that professionals can serve the society. So it's a mutual thing. So if the number of professionals are increasing, the society cannot support them, then there will be a crisis. That had happened for nurses in some of the southern states. In Kerala itself, the number of nurses increased very much at a particular time. Then there were no job opportunities. There were not sufficient salary was not paid to nurses. So there were strikes. So that went to a lot of crisis in the health sector in Kerala. So if the number disproportionately increases, mushrooming occurs, that won't help. And another thing is that that cyclical phenomenon they cannot explain. For example, a lot of medical colleges were added. Then, considering in COVID, respiratory medicine was an important subject. Then, emergency medicine was an important subject. A lot of trauma cases are there. Then, physical medicine was an important subject. A lot of physical disabilities have to be addressed. They were added to the medical curriculum some 4 years back to improve the medical curriculum and to improve their knowledge about these areas. Then last year, they were removed from the medical curriculum due to lack of faculty. So these type of lack of planning will not improve the medical scenario in India. That's one of the issues.
Dr. Vankirkar, would you also like to add to this?
I totally agree that there should be, what I meant when I said that there should be a national master plan. It encompasses all these factors, the requirement, the catering population, whether the population will be coming to the medical college. Because unless and until patients come to the medical college, how are the students going to get clinical experience?
Exposure.
In one district, you have a private medical college, you have a government college. That is situation practically in all districts in our state of Maharashtra. And you can't really expect then that the patients will go to the private medical college for because there is some charging, and while the government medical colleges are totally free. So there should be definitely a national master plan. 20 years back, Maharashtra University of Health Sciences had made a master plan based on certain parameters. I think it was an excellent idea, but again, due to political pressure, politicians wanted private colleges, it was scrapped, and the particular vice chancellor was unceremoniously shifted, who had prepared it very nicely.
Yeah. So another important factor is a shortage of specialists. While we agree that there is no shortage of MBBS doctors now, there is definitely shortage of specialists beyond metros and tier 2 cities. So how do you think can that be addressed, and what are the measures in place should be in place in order to address this issue? Dr. Alapat, would you like to start on this?
It's as we told about the medical practitioners, the shortage of specialists. There may be a shortage of specialists in some of the specialty areas, but actually that's not so true. The thing is that many of the rural areas, many of the second tier areas, they don't have the facilities to cater for the specialists. That's the issue. If the facilities are improving, automatically the specialists reach there, they will start doing their service. The issue is that the facilities, the infrastructure, the supporting facilities, everything should be available to give a specialty care to that particular area.
So it's not really the issue of the specialists not wanting to go there as much as the lack of supporting infrastructure and equipment, etc., for doctors to perform at places like community health centers, for example, where there is acute shortage of specialists still. Dr. Van Khirkar, would you like to say something on this as well?
Firstly, I would slightly have a different opinion that there is a shortage of specialists even in rural areas. Let us look at both the streams, the public sector, that is the government stream, and the private sector. In the government sector, as I mentioned, bad governance. You post a gynecologist and you don't post a pediatrician or an anesthetist there, where then in some surgical procedures can be carried out. Or you don't give an ultrasound to a community hospital. And secondly, again, the issues of giving contractual basis appointments. And bond is killing regular service, entry of regular service into government health services, because students come just to complete the bond for 270 days out of 365 days. 60% times they don't attend, they pay half of their salary to the regular medical officer and just take a certificate. This also creates that those half of the seats are not available to regular medical officers who will stay regularly and then continue in the government service till they retire. So that is about the government sector. About the private sector, most of the taluka places, forget tier 2, tier 3, tier 4 cities, I am talking of taluks. All the taluks practically are now having all the 4-5 major broad specialists. That is a physician, a surgeon, a gynecologist, a pediatrician. All of them are available. Even I come from a tribal district. All my 4 taluks have CT scan facilities in the private sector. And as I mentioned again, if at all government feels, they should again prepare a master plan. There is no such, if there is a no radiologist, give him incentives. You give crores and crores of rupees of subsidy to industries to set up. See, remember, private medical hospital, private hospitals are also a largest source of employment. And especially the female workforce is maximum in the health sector. Considering the unemployment issue which our country is facing, if we don't promote private sector hospitals, then employment issue will be a problem. So considering that, they should subsidize and incentivize private sector to go into peripheral areas.
Yeah, that's a very important point. So, in nutshell, we now agree that the medical education system in India needs a complete overhaul, and there has to be some very specific strategy that needs to go into how medical colleges are opened. With this, we come to the end of the discussion. Dr. Van Khirkar and Dr. Alapat, really appreciate both of you taking time out for this. Thank you so much for joining, sir. Thanks.
Thank you.
Thank you very much. Thank you, Sumi.